According to Health Minister Zweli Mkhize, none appear to have been infected by patients. However, nurses and other healthcare workers have said there's a shortage of masks and gloves for those working on the front line. Joining us now, we've got Simon Hlungwani, who is the president of the Democratic Nurses Organization of South Africa, that's DENOSA, as well as Zola, Saphetha, who is the General Secretary of the National Education, Health and Allied Workers Union, or Nehawu. Gentlemen, thank you very much for being with us. Welcome to Morning Live.
Good morning.
Good morning, viewers.
All right, let's sort of start with this. Given that we come from a background of under-resourced hospitals and clinics, how long have nurses and other healthcare workers been saying that there's a shortage of masks and gloves for those who have to work on the front lines of combating COVID-19? Simon, let me begin with you.
Well, I just want to indicate that from the report that we get from our members as far back as yesterday, is that we've seen a difference between the urban areas, the big hospitals and the smaller hospitals. But one thing we can confirm is that in most clinics and most rural hospitals do not have adequate protective clothing. And in this regard, we have said to our members and we are still advising, if there is no PPE, you should not risk your life, and you should not, because it will be equal to committing suicide. Because if you get infected, you're going to infect your fellow colleagues, you're going to infect your family, and everyone else that you're going to be in contact with. And we are also aware that there's a shortage of testing mechanisms or test kits in rural areas. So the testing in some other provinces only done in the big hospitals and not in the small hospitals. And that's going to be a deterrent for us to win this battle. But generally, there's a shortage of PPE, and particularly the use of masks. And some management have resulted in telling some of the not to wear all the time certain types of masks or even gloves to apply at a particular time, which is what we discourage, because what must be made is availability of PPE. If there is no PPE, there's not going to be able to provide care, and also we're not going to be able to test in this regard. And we know that the president said we are going to scale up the testing, but that testing requires that we have adequate human resource, but we also need adequate PPE, because without it, you're not going to be able to do anything at all. Yeah. We have general conflicts that are coming. And I must condemn that yesterday when there was an incident in Belcom at the Bongana Hospital. The incident was sparked by the fact that nurses in that institution were provided with transport in the evening, and in the morning when they have to go off duty and they are waiting for transport, the CEO then called off that transport, and it happened that they were disgruntled with this process until one of the managers, which is the laboratory officer, ended up calling the police, and the police arrived there. Unfortunately, he instructed them to fire rubber bullets, which resulted in some getting injured, when they were genuinely talking about the means of getting and coming out of work, and which was uncalled for.
Yeah. I mean, these are tough stories to listen to. They really are, for people that are going out and risking their lives on a daily basis to fight this pandemic. Zola, Nehawu is encouraging its members to continue to fight against COVID-19. Why do you, I suppose, have such confidence in your members at a time like this, even though we're talking about under-resourced in terms of gloves and equipment to help them? So let's begin there, also calling for them to go and work, but also the lack of resources that they have and your concerns.
Leon, the truth is that our members, they are caught up in between the rock and the hard place, because complying means death, and complaining means dismissal. So we have members and the health workers who don't have a choice. And the choice that they make must be a balance between their survival and feeding their families. So that's this kind of a situation. But also, as a transformative union, we can't just be reckless and say, tools down, because certain instruments are not there to defend your work, because we'll be killing the nation post this virus. Yeah. So the truth of the matter is that this campaign is not new. We have been campaigning for protective clothing for years now. But unfortunately, the kind of a government we have is not a government who finds it so easy to listen and to comply and act as a custodian of the same law that they put in place. So that's a real challenge that is confronting us yet. Yeah. And I'm agreeing with the President that we need masks, we need gloves. But the most important thing, in addition to what the President said, we need ventilators, Leanne.
Yeah.
Because now, as you know, that this virus has a peak time. And South Africa, we're going to that peak time now, where large number of people will have to be hospitalized and will have to stabilize through the ventilators, because this virus makes it so difficult for an individual to breathe. Hence, we lose lives. Yeah. So currently, we don't have that. And also workers, they are citizens of the South Africa. They are protected by the Section 11 of the Constitution of the Republic of South Africa, which gives a right to life for everyone. So at this point in time, we can't do things as usual. We have to do and put drastic measures to defend and protect our members and the health workers under this deadly virus. So that's why we opted to take the minister to court.
Yeah. Zola, I mean, your concerns are real. They really are. And we know, of course, that this is a global shortage when we talk about gloves, masks, ventilators. It is a big problem. But, perhaps you can enlighten us, because obviously these calls are being made, and they have been made for quite some time now. But do you think, and Simon, let me bring this question to you, is that the Department of Health have been too slow? Have they been too sluggish in this response in terms of the things that I've mentioned, the shortage of gloves, masks, ventilators, life-saving tools that are needed to fight this pandemic?
Well, Leon, I think it is the fact that our government has said, before we even had a single state in South Africa, they have said we are ready. Now, if the meaning is that we are ready, it means we also have a plan at that given point that suggests that we will be able to deliver the resources needed in all areas at that particular time. And I swear it was, if right now we have a shortage, it simply means that there is a problem in our manner of managing the current pandemic. And the problem with the whole thing is that no one is immune to the virus. That includes health workers. As a result, we simply say, do not commit suicide, because your right to life remains also a fundamental right to yourself as a healthcare worker. But over and above that, if our government said we are ready at that time, it meant that we ought not to behave in terms of the current moment. Otherwise, it simply means that we are failing to manage systems. And mind you, Leon, at the current moment, no danger allowance is provided to nurses and or other healthcare workers as we speak. And we think this should be implemented as a matter of urgency, because health workers as well are in a danger, and they are not even compensated for that matter in this regard. So we are worried that it looks like government is moving in a sluggish pace, but we know that our country needs these health workers, and then the country knows that these health workers are very important. And for us, it's a non-discussable issue. It's a non-starter. It must just be provided for, because we need to be able to provide health care, and we can only do that if we are given the resources necessary for that matter.
Yeah. I mean, Zola, one of the other big issues is the fact that we are under-resourced in our hospitals to begin with. On a normal day, the resources there, and I'm not only talking about equipment, I'm talking about staff, and both of you have raised this as a major concern. No danger pay, the hours and the responsibilities that are going to be passed on to healthcare workers is going to be massive. What is your response to all of this?
You are correct, Glenn. By the way, let's start by saying health care system in South Africa has been a battle for looting, not institutions to care for the nation. There has been enough resources, but our state had allowed resources to be taken by individuals, and there have never been consequences in that area. So generally, that's why therefore now when we call for the filling of vacancies, we'll also be told about the lack of resources, be told about the economic decline. And with this problem that we're confronted, it is a self-made problem. And even at the time when the resources were enough, what did we do as the country? It's a pity the end that we are in a program without the minister, who have been spreading lies to public, creating an impression that South Africa is prepared to deal with this crisis. How would you argue public that you're prepared, yet you know that we have a challenge in terms of your resources and putting measures that respond to this? For instance, Elian, here's the fact. We are participating as Nehawu in the National Nerve Center, which is an inclusive committee that deals with this crisis, led by the Department of Health. And it's quite clear from the reports coming from provinces and different levels of institutions that there are no efforts even to buy and procure these PPEs. For instance, there is no single province that have demonstrated to us that there have been efforts in their attempts to secure, other than to say they have placed an order. Since last week Thursday, even if we can ask each and every MEC today, they will just tell you the same thing. We have put an order to procure this. Yet our members are on the ground, on the line of duty, doing this thing without this thing. So the truth of the matter at the end is that our government is not prepared for this. And we would have loved to have the minister on your program so that we expose and reflect the thing as they are, without really being perceived as people who are accusing others.
Yeah. All right.
And the list that we are having, for instance, through our investment arm as Nehawu, we've been able to tap into resources in the form of having hazmat suits, in the form of sanitizers and so forth, but also funding in a manner that we can also help the manufacturing companies to produce more of these things in our country. But we can't bring those things, we can't come with them, because we need an approval of the government, in particular the Department of Health. And the frustration that we're confronted with, the Department of Health doesn't want to meet with us. Since the 5th March, we've been talking to the minister. And what is it that is so difficult for the minister under these circumstances to listen to each and every stakeholder?
Yeah, I want to talk about some of the threats that have been made, and this, of course, Simon, comes to DENOSA. Today is the 1st of April. You did say that workers will go on strike because they are doing duties of 3 or more people, which we've been talking to, and also want salary increases. Let's talk to the strike action. Is it imminent? Is it going to go ahead, or are things on hold right now? Simon, can you hear us?
Hello.
Yeah, Simon, did you hear the question? Shall I rephrase? Shall I repeat it?
Let's repeat for me, please.
Yeah, we're talking to the strike action. So today, as you know, is the 1st of April, and you did say that workers will go on strike because they are doing the duties of 3 or more people. You're also wanting a salary increase. Talk to us about the strike. Is it imminent, or have you called it off?
Well, Ulen, to put the matter straight is that if we were to go on strike in any manner, members themselves should have taken that decision. And I want to confirm there that I see that you put a picture that is not mine. That's not my face. I want to go on record of that. I've sent a touch to you now on message that is not my picture. And it shouldn't have been put it that way. But nevertheless, members of DENOSA have not as yet given us a go-ahead. We must take a strike actually with regard to that matter. However, we have engaged in a process of a dispute mechanism through the bargaining process in dealing with the matter of the dispute. And in that, we have tabled as well the matter of danger allowance for nurses and healthcare workers during the COVID-19. The employer came to us and said, on the day that the matter was tabled, the employer said they don't have a mandate and they're asking for time to go and consult their principals. This was the employer with regard to that matter. But there is no decision to go on strike as yet, because we are engaging in internal processes that if it fails, it may lead to that process. But members will still have to decide what will need to be done for themselves, and with regard to fighting for this thing. It's a situation where we are in the cold phase, we are under danger, we don't get the danger allowance. But in the meantime, the government says we can't even give you an increase. If people are not recognized, these are appreciated for the work that is being done and the actions that we are going through in the current moment.
Okay. Then just finally, Nehawu, I'm going to ask you the same question, Zola. In terms of strike action, any plans on your side, or are these demands that you are making, because you obviously, this is for the interest of everybody, these demands, and they need to be adhered to. But in terms of strike action, is that on the cards or not?
On record, Leanne, we have cancelled our march, which was intended to be organized on the 30th March. Because beyond reasonable doubt, we have demonstrated our commitment to save lives of South Africans in particular. We could not then risk the lives of our members by getting into the march. But one thing that we want to say, Eliane, we will fight this under the circumstances of a lockdown. That's why we are preferring for court of laws. But the truth of the matter is that we can't be in the lockdown perpetually. Watch the space, Eliane. Will emerge out of this lockdown very energized, very prepared to fight for our rights as workers, because we think that government has taken us for a ride and has taken us for granted. We'll do our best to save the nation under these difficult circumstances, but we will emerge and fight for our right and our dignity. I can assure you that.
Yeah. Gentlemen, I thank you. Thank you for being with us here on the program, talking to us about some of the issues that are affecting healthcare workers at a time like this. These are the people that we need to applaud every single day that go out to work to try and save lives. Simon Hlungwani, who is the president of the Democratic Nurses Organization of South Africa, and Zola Saphetha, the general secretary of the National Education, Health and Allied Workers Union, giving us their respective unions' perspective on combating COVID-19, but all strike action for now has been called off, which is indeed good news for South Africans. Let's take